Hi, in this video, we'll be discussing about how often a person should undergo screening for rectal cancer. This is a very common question that everybody asks as to how often a person should undergo any form of test to detect colon and rectal cancer in their life. There are guidelines for this. An individual should start screening at the age of 45. So beginning at the age of 45, either annual or once in 10 years is a test that is recommended. So if you are doing once in a year, it is usually a fecal occult blood, which means you have to test your feces, stools, for any traces of blood, which you can't even see. It's a test that is done in a test tube. Yeah, that is a slightly uncomfortable test, but if it is done properly, colon and rectal cancers can be detected. What is better is colonoscopy. Colonoscopy is a test where a camera is introduced into the rectum and colon, of course, to check if there are any precancerous conditions in the colon and rectum. These precancerous lesions or diseases, what we call as adenomas, take about 10 to 20 years to grow into cancer. So that is the window of period in which if we catch early enough, we don't even have to think of cancer. So the disease would be nipped in the bud. So the idea of screening with colonoscopy is to detect it even before the first move towards cancer happens. So it will be just one small projection in the colon which can be caught, removed with a snare, and that will end the disease. There is no further problems at all. Now, there are other things, important things to remember. There are families with higher incidence of colon and rectal cancer. So for them, the way we manage is completely different. So what I have told is applicable to all those people who have a normal risk. Now, there are a few papers or research which has come in the recent past, which has shown that even a sigmoidoscopy or a colonoscopy, sigmoidoscopy means looking at only a small portion of the rectum and colon, which is done once in 20 years, is also sufficient to give you enough protection. So if that is the case, you might have to go for a colonoscopy once in, or twice in your entire life, or 3 times in your entire life. So that is a beauty of doing colonoscopy as a screening test. Again, colonoscopy is slightly uncomfortable test to perform, but when done properly, the results are phenomenal. So to summarize, rectal cancer can easily be prevented by performing certain tests like occult blood in stool examination or by performing colonoscopy. Thank you.